should people applying for unemployment in this state be forced to take a drug test? And if they do, are they at risk of failing because of perfectly legal medicine?
We've reported on this controversial bill making its way through the Arizona legislature. If Senate Bill 1495 passes, it would require the state to set up a drug testing program. As of today, there are nearly 82,000 Arizona residents receiving unemployment checks of $240 a week. Pharmacist Stuart Gethner at Fairmont Pharmacy in Phoenix tells us he's had a lot of people asking questions, worried about losing their benefits, and he says they have a right to be worried because there are a lot of perfectly legal medications that could cause a person to fail a drug test.
I just want to make sure that our patients are educated and that some of the medications they may take may send out a false positive on certain drug tests.
Do you think people would be surprised to hear how many medications that are perfectly legal would trigger a false positive?
I think people would find surprising that certain medications that we take daily.
For instance, he says the muscle relaxer Soma could cause a false positive, as well as the sinus medication Sudafed. I did put a complete list of the prescription and over-the-counter drugs that he says could show up on a drug test on our website. Go to azfamily.com. And he says that he's also getting a lot of questions from people who use medical marijuana and what this would mean for them.
That is a good question for them. Of course, we're going to continue to follow Senate Bill 1495, which will now be considered by the full House.